Many of my patients ask if they would be healthier eating a gluten-free diet. Well, here's the answer. If you're one out of 100 people in this country who have celiac disease, then by all means, gluten-free is very important. People with that celiac disease, they have a swelling in their intestines when they eat gluten, a protein component of barley, rye, and wheat. And they often really are very sick. They lose weight, they have bloating and cramping. They need to see their doctor and get a blood test to determine if they have celiac disease. Sometimes some intestinal biopsies are even necessary. About 6 out of 100 people in this country have gluten sensitivity. They have some cramping and bloating, sometimes fatigue and joint pain. And so if that's the case, they should still see their doctor and make sure they don't have celiac disease, get the blood tests. If those tests are negative, then a good step would be to just eat a healthier diet. So to cut out baked goods and processed foods, eat more fresh fruits and vegetables, less fried and fatty meats, and that often will get people feeling better. If after 1 or 2 months they're not feeling better on this improved diet, then it'd be worthwhile to go gluten-free. Try the gluten-free diet for about 2 or 3 months, then it's not a bad idea to reintroduce gluten to see if you truly are allergic to gluten. Many people just have like a placebo effect and they're not truly gluten sensitive. Why should you do that? Well, it's about 3.5 times more expensive to go gluten-free, and it can be stressful and unpleasant to do. And let's face it, gluten-containing foods are not necessarily unhealthy. Wheat, rye, and barley protein gluten is not a bad thing for you. It's like nuts. If someone's allergic to nuts, they shouldn't eat nuts because it makes them sick. But for the rest of us who aren't allergic to nuts, nuts are a healthy part of our diet. Same thing with gluten. If you're not allergic to gluten, then you don't need to be gluten-free. Eating a gluten-free diet, if you're not allergic or don't have celiac disease, is not necessarily healthier. That's a Minute for Health.